you have a pain that most people think should go away and it's just getting worse. It's not really responding. It's much more severe than what everyone thinks it should be. That could be CRPS. CRPS is generally found in the extremities. It's more common after a injury or a surgery to a nerve, and so a no nerve damage that causes it to have worsening pain, such as if you had a surgery and the nerve was cut, whether on purpose or on accident. That can make the nerve very angry and eventually cause the nerves around it to also become angry, and you develop what we would call CRPS. Now, CRPS has some distinguishing hallmarks to it. You have to meet Budapest criteria. Some of those criteria is you have to have some hair, skin, nail changes, some swelling changes, temperature changes. All of that is something that's very difficult for other doctors to identify and diagnose. Here at MD Pain, we are treating CRPS all the time. We have patients who come in from out of state for this, all over the state of Colorado. We are very proficient and knowledgeable at it. Sometimes CRPS has different stages. So the stages can be from the very, very beginning, where it's difficult to truly identify a CRPS, versus some more advanced cases where it can even have spread. There's disagreement in the medical community as to whether it can even spread, but in our experience, we've seen it go to all sorts of different places, not just limiting to the extremity it first started in. The treatment factors for CRPS, there's the physical therapy, which is generally the hallmark, but you have to find the right physical therapist, which we do know in the community. We've asked around as to who does physical therapy for CRPS. You can't just go to any physical therapist and expect them to be able to treat you for it. It's a very difficult thing to treat, but the earlier you diagnose it, the earlier you start treatment for it, usually the better results you have. Here at MD Pain, we treat you with not just identifying the right physical therapist for you, but also medication management. And it's not just narcotics, although that can be part of your treatment program. We also do nerve pain medication, smooth stabilizers, and maybe they're not helping you get that pain go away, but maybe it's also preventing it from spreading, which is also a treatment goal. We also do injections. So the injections we use for this depend upon which part of the body it is. It could be a stellate ganglion for the upper extremity. It could be a lumbar sympathetic block for the lower extremity. It could even be something as a hypogastric or a celiac plexus if your pain has spread into your abdomen type regions, or pelvic regions for that matter. So there's many different options. We also do spinal cord stimulators for it, and there's just a wide variety of ways to treat CRPS. It is a difficult thing to treat, but the earlier you get diagnosed, the better off you usually are.